Joel Michael Singer explains amazing facts about neurosurgeon. Joel Michael Singer. The empirical experience of the last 40 years of my practice suggests that the success rate for experienced surgeons. Patients know that the surgeon is qualified to perform their MVD, and personal data supports this claim. It is increasingly common for hospitals to allow their neurosurgeons to do research because it is more economical for the hospital to work full-time. For example, the emotional impact and possible negative consequences for the pediatric patient may be sufficient for a neurosurgeon not to specialize in pediatric neurosurgery. As neurosurgery develops, brain surgeons have to make time-sensitive decisions on a case-by-case basis. In unconventional cases, they rely on their problem-solving skills to find new ways to diagnose and treat neurological diseases. Joel Michael Singer, neurosurgeon, assesses, diagnose, and operate disorders of the central nervous system, which includes the brain and spine. He works on the body's nerves and spine, and the wrong move can cause paralysis or permanent brain damage. Joel Michael Singer treats patients of all ages, from newborns to babies to the elderly, and treats a range of diseases. We all know that doctors who perform surgical treatments on the brain and nervous system are known as neurosurgeons. Neurosurgeons perform operations on everything from carpal tunnel syndrome to the removal of brain and spinal tumors and spinal surgery. Joel Michael Singer is responsible for caring for the nervous system, which includes the brain and related structures, including the spine, nerves, including peripheral nerves, blood supply to the brain and spine. This broad spectrum means that neurosurgeons understand not only how the brain works, but also the cardiovascular system and the entire human anatomy. Pediatric neurosurgeons often face unique neurological disorders that affect children. In addition to caring for patients with head injuries, brain and spinal tumors, vascular malformations, and seizures, they also spend a lot of time caring for children with hydrocephalus. The typical diseases a neurosurgeon deals with are head and brain injuries, brain tumors, aneurysms, herniated discs, and spinal malformations. When it comes to medical management, there is an essential overlap between neurologists and neurosurgeons. Neurosurgery is closely related to neurology, and both the neurologist and the neurosurgeon require special knowledge of the nervous system and how it works. Joel Michael Singer performs complex neurological tests such as EEG, MRI, and CT to monitor the brain, and both use invasive procedures to repair blood vessels in the brain. In the spirit of neurosurgery, the field has integrated neuroscience research. Neurosurgeons and neurologists diagnose and treat nervous system disorders, but neurologists do not perform surgery. Choice time for research is built into residential programs, and most academic neurosurgeons engage in all kinds of research, from basic neurobiology to clinical research on neuroscience topics. When I asked neurosurgeons their reasons for choosing neurosurgery as the obvious cause, there were several common themes that seemed to draw most of them into the profession. The brain is the physical house of mind, but the mind is not limited to the brain. The intelligence of your mind permeates every cell of your body, not just brain cells. When you add it all up, it's amazing that the skull, which weighs 3 pounds and has the texture of soft tofu, has no central command over you. Before becoming a neurosurgeon, Joel Michael Singer received extensive training in surgical and neurological diseases. Neurosurgeons will inform you about how doctors focus on the surgical treatment of peripheral nervous system disorders. It is a medical specialty that deals with the diagnosis and treatment of patients with injuries, diseases, and disorders of the brain, spinal cord, spine, peripheral nerves, and body parts. Joel Michael Singer works with his professionals to provide comprehensive inpatient care to patients with complex neurological disorders. Depending on the nature of the injury or disease, Joel Michael Singer performs both surgical and non-surgical treatments. Surgical emergencies such as bleeding in the brain or sudden compression of the spinal cord can occur at any time of the day or night and require immediate attention. Cases of severe brain injuries, paralysis, and damage to the spinal cord and brain tumors in children attract neurosurgeons to look after them. Cerebrovascular neurosurgeons deal with disturbances in blood flow to the brain. They perform surgery to relieve the narrowing of the carotid artery in the neck and to remove aneurysms, arteriovenous malformations, in the brain.